and has been selling Hondas for 50 of those years. From the first days the doors opened, our dedication to quality customer service has never wavered. Whether a new Honda or pre-owned car, van, truck, or SUV, the certified pre-owned Hondas to service after the sale are all the reasons why we say nobody beats a Bryan Honda deal. Not now, not ever. So, when considering your next vehicle purchase, come to Bryan Honda or visit BryanHondaFayetteville.com.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The We Do Radio Network, WAGR in Lumberton, WYDU in Red Springs, and WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
And thank you so much, Ray. Welcome to another episode of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones, and today we have a very special guest in the studio, Mr. Mike Nagowski. He is the CEO of Cape Fear Valley Health, and he is going to tell us about, give us an update about what's going on at the health system and how the health system is helping the community. In addition, during the second segment, we'll discuss respiratory illnesses with Cape Fear Valley resident physician, Dr. Humza Rana, and he is an internal medicine physician. So we're going to talk to him about all of the different respiratory illnesses that are floating around the community. And I fell victim to it last week, so I know it's out there. But ladies and gentlemen, what I want you to do is make sure you share the broadcast if you're following us on Cape Fear Valley's Facebook page, or if you're following us on the YouTube channel. We want to get the word out. We want to get the health and information out, so make sure you do that for us. Ladies and gentlemen, first up, Mr. Mike Nagowski. As I said, he's the CEO of Cape Fear Valley Health on Making Rounds Live. Mike, welcome back to the broadcast.
Good morning, Omega. It is wonderful to be here. Thank you so much for having me.
Well, thank you for taking time out of your schedule to join us. Now, Mike, let's talk about your accomplishments at the health system. What are you most proud of going on at the health system?
Oh, Omega. We are so blessed. We have so many things going on. You know, at the core of what we're doing is we are growing to meet the community's needs. You know, we live in such a wonderful community with so many needs, and that's our focus. How do we grow and expand to meet the community's needs? And if you don't mind, I'll start right here in Cumberland County with two of our most visible projects, right? You can't go on Owen Drive and not see all the growth and development that we have there. You know, last year we finished one of the most significant projects that will have a ripple effect through our community for decades, and that's the creation of the Center for Medical Education. That 5-story, 120,000 square foot building has two primary purposes. One, it's the home of our physician residencies. And you know, we're so very proud of our physicians in training. They're doing a fabulous job. We have almost 300 physicians in training right now.
Wow.
And every single year we continue to grow that. And we are attracting fabulous residents, just outstanding individuals who are going to make wonderful physicians. We're very proud to be training the next generation of physicians. So that building opened and is in full use. And one of the jewels there as a part of the residency training is our simulation center. Omega, it's world class, one of the very best sim centers in the entire state. And then the other purpose for that facility is it houses our Neuroscience Institute. So all of our neurosurgeons, our neurologists, all of the nurses that are part of that program are housed there. And you know, they're on the top floor. They're on the 5th floor.
Yeah.
Where exactly they should be.
Yeah.
And now, no matter, I think, anytime you're anywhere near the campus, it's almost impossible not to see the construction that's going on today. We're really looking forward to that. I think it's going to transform care in our community. We've added 2 entire floors to what we call the Valley Pavilion. We've had cranes operating around the clock there. Those 2 floors are completely encased in glass. It's going to add 100 medical beds to this community. And of those beds, most importantly, 40 of them will be ICU beds.
Okay.
And people have asked me, Mike, that's a lot of ICU beds.
That is.
And that's exactly what we need, because Cape Fear Valley receives a lot of transfers from hospitals in the region. Every single day, our helicopters are going, picking up patients, bringing them to Cape Fear Valley. And what those outlying hospitals really covet from us is our intensive care. We have fabulous ICUs manned by full-time physicians who only work in the ICUs, dedicated nursing staff. We have separate pharmacists who only work in the ICU. And that's the need for our region, because every single day we cannot accept some of those transfers, and that's heartbreaking to us. So all of that development is going on to expand access for our community. And then on top of that facility is where our helicopter pads will be. So think about it. In today's day and age, we're very proud that we operate helicopters to bring patients back and forth. But the only place they can land now at the medical center is on the front lawn.
On the lawn.
Right? And they do a great job landing there, but the logistics of getting a patient from that location into the cardiac catheterization lab or into one of our trauma bays can be overwhelming. So now when that building is finished, our helicopters will land on top of the building, go immediately to an elevator, which will take them to either the trauma bay, the emergency department, or the cardiac catheterization, because time is important. If you're in a trauma or you're having a heart attack or a stroke, time matters. So we want to get you to the right treatment as quickly as possible. So right here in Cumberland County, those facilities have been accomplished and are in the process of being developed. And I'd be remiss, could I talk a little bit more about some of the other development on the campus?
Yes, sure, go ahead.
You know, one of the facilities that doesn't get talked about as much as those visible projects that we're really proud of is our development of an inpatient unit for adolescent behavioral health.
Yes.
That we did in partnership with the state. The state provided a lot of funding for that. And every single day now, we have adolescents who are in need of inpatient behavioral health being taken care of right here in Fayetteville. Before last year, those patients and their families would have to seek care out hours away. You know, and when you have a child, we all have children, when you have a child and they're going through an issue that requires them to be hospitalized, there's a lot of stress on the family. Think about the added stress of having to travel 2 hours to see your child. So we're really grateful that the state had enough faith in us to build that facility. So right here in Cumberland County, very visible, very tangible growth to meet the community's needs. But just to tell you a little bit about Cape Fear Valley, not just here in Cumberland County, but in Bladen County. You know, I was just talking about the helicopters. We've actually added a helicopter pad to the Bladen County Hospital and stationed a helicopter in Bladen County.
Wow.
Bladen's a wonderful facility. They do a great job, emergency care. They do surgery during the day, not after hours. And they have a wonderful inpatient unit. But sometimes they need care that's above what the staff there can provide. And so they'll bring those patients to Cape Fear Valley. That is why the helicopter was so important. Because it's about an hour drive from the Bladen Hospital, but in a helicopter it's minutes.
Okay.
And as I was saying before, those minutes matter. The other thing that we're doing down in Bladen County is we've completely updated their emergency department, and they're getting their very own MRI machine.
Really?
Yeah, so we're real excited about what's happening in Bladen County. Wonderful facility. They do a wonderful job. The medical staff here at Cape Fear Valley actually rotates down and provides services at Bladen County. So you might see the same physician in our ED here that you'll see at Bladen County.
Okay.
Yeah. And just to tell you a little bit more about, you know, the reach of Cape
Go
Fear
ahead.
Valley is pretty significant. Hoke Hospital, right, has done such a wonderful job. You know, they're seeing more than 50,000 emergency room visits there, and all of that has resulted, numerous years in a row, they've earned a Leapfrog A and a 5-star rating from the Centers for Medicare and Medicaid. We're very proud of the work that they're doing out there. And I don't know, Omega, if you've heard, but we recently announced in partnership with Methodist University
Yes.
that we're going to bring a medical school to Fayetteville. Huh? How about that?
I know.
We're really looking forward to that. You know, our experience with training the next generation of physicians has been outstanding. More than 50% of those physicians that we've trained have decided to stay and call this their home. So it gave us the confidence that in addition to providing the residency and fellowship training, we could do the medical school. And as we looked around, Methodist was the absolute right partner. I've never seen somebody more enthusiastic to bring a school like that to the region. So it's just been wonderful. As I tell you, we have a lot to be thankful for, and we have a lot to say grace over.
Okay. You mentioned partnership, you mentioned the medical school. We understand the significance of the medical school for the health system and for Methodist. Now, John Q and Sally Q Public that are listening right now, and they're saying, okay, the medical school, yeah, it's going to benefit the hospital and it's going to benefit the university, but how is that going to benefit me?
Yeah, Omega, absolutely. And I hear you loud and clear, right? It gets personal quick. Well, there's a number of ways this is going to help. On the healthcare side, we really do live in an area that does not have enough physicians, right? We live in a bit of a doctor desert. Now, we're solving that problem with the residencies, but we still have a long way to go. And the other thing that's important to recognize, just look what happens in communities that have medical schools, right? Look at the health outcomes of the population in that region. They all elevate. Every location that has a medical school has seen a dramatic improvement in the outcomes of the health of their population. Unfortunately, we live in an area with poor health outcomes. I think in the state we rank in the 70s, right? Everybody who has a medical school, all the areas in North Carolina with a medical school, they rank in the top 25. That's what you're going to see. It won't happen overnight, but this medical school, which will be an MD medical school, will transform. Because remember, with those physicians comes health outcomes research, medical research, drug research, all of those things that elevate a community's health. The second part that a medical school will bring will be economic vitality, right? Just think about this for a second. Who teaches doctors to be doctors? Who do you think?
Teachers, instructors, professors.
Yeah. And those instructors themselves are physicians. So we will be hiring an additional 40, 50 more physicians to provide education for these doctors in training. Physicians, by the very nature, are high income earners, right? So we will be bringing all of that economic vitality to this region. We had North Carolina University, right? I'm not here to talk about what color basketball team uniform they have, but they did an economic study for what a medical school does for a community. It was in excess of $700 million of economic vitality just in the first 10 years, Omega. So whatever boat you're in, if you're interested in great health outcomes and you want to see a population's health improve, the medical school rings that bell. If you're on the economic camp and you want to see Fayetteville continue to grow and prosper, we'll ring that bell as well. It's just terribly exciting to see all of the growth happening and partnerships.
Ladies and gentlemen, Mr. Mike Nagowski on Making Rounds Live. You all know who he is. He is the CEO of Cape Fear Valley Health, and just in case you did not know, Cape Fear Valley Health System also brings you the broadcast Making Rounds Live every second and fourth Tuesday of the month. Now, if you're listening on WIDU or the We Do Radio Network, sending out a big hello to everyone listening in Cumberland, Scotland, and Robertson County. And if you're watching us on Cape Fear Valley's Facebook page or YouTube channel, as I mentioned earlier, make sure you share the broadcast because we have some great information for you this morning. Mr. Mike Nagowski in the studio on Making Rounds Live. Mike, we've already discussed a lot. Will 2024 be just as busy?
Omega, it certainly will. First off, we have all of these projects that we're currently saying grace over that we've got to bring to fruition, right? We've got to execute on all of those plans. But up in Harnett County, we had the same level of activity going on. Right now, we are in the process of two brand new facilities, one which is a full-service cancer center. You know, the medical oncologists at Cape Fear Valley have been providing oncology services up in Harnett County for almost a decade already. But we never had radiation oncology. And to have a comprehensive cancer center, you need both disciplines, right? I remember when my mother-in-law went through her cancer treatment, she had to receive both radiation and medical oncology. So to have it immediately available in a community is a big deal. And we're looking forward to making that happen. By the end of this calendar year, so by the end of 2024, I expect that that facility will be up and operational. And no longer will the citizens of Harnett County have to travel great distances to receive outstanding care. And then the other project that we have is up in the Anger area, which is in the northern part of Harnett County. We have a brand new 16,000 square foot medical office building going up because more and more specialists are coming to join the Harnett Health team. So whether it be orthopedics or GI, urology, ENT, or internal medicine, that county is really growing its health outcomes.
What about any big news for the cancer patients here in Cumberland County?
Yeah, thank you, Omega. We're really excited about the growth. You know, more and more people come to Cape Fear Valley for their cancer care than ever before. I wish no one had to come for cancer care, right? But it impacts everybody. I've already told you my mother-in-law has been impacted by cancer. My wife has been impacted by cancer. Both of them are cancer-free, and we're grateful for the care right here in Cumberland County. But for citizens who are impacted, I want you to know that we just successfully received accreditation from the American College of Radiation, American College of Radiology on radiation oncology, and the National Accreditation Program for Breast Centers. Those are two of the gold standards. When you're measuring cancer programs, you want those accreditations. So we're really glad that those programs have come. The other thing that we're really working on is care of a cancer patient who is in the middle of their treatment. And because of that, we've added an outpatient palliative care clinic at the Cancer Center on Owen Drive. And while that is certainly the focus and we have the most activity at the medical center, up at Health Pavilion North, which is just north of the Methodist campus up on Ramsey Street, we have a wonderful facility there. And we have greatly grown and expanded both the medical oncology and the radiation oncology. We really want to bring oncology services to people. When you are being impacted by cancer, the last thing you want to do is have a lot of travel involved, right? So our bringing cancer care to those communities is really important for us. And I just have to say, we are eternally grateful for the generosity of this community. If it wasn't for the philanthropic efforts in this community, these projects would not have come to fruition. So we're grateful for the generosity of the Fayetteville and Cumberland County region.
Today's guest on Making Rounds Live, ladies and gentlemen, Mr. Mike Nagowski, CEO of Cape Fear Valley Health. Mike, what are some of the challenges that the health system is facing this year? And are these challenges unique in our area, or are there larger challenges for healthcare in general?
Well, I think the industry is really going through a lot of transformation. You know, about half of the nation's hospitals are actually losing money, right? So that's a challenge in any industry. Fortunately for Cape Fear Valley, we're not in that half, right? One of the major issues that I think we're seeing across the country are shortages of workforce, right? It starts with the physicians, and that's why we have very methodically begun to address the physician shortage in our area. First, the physician residencies and fellowships, and now a medical school. But it doesn't end with the physician workforce. The next big category is nursing. And we're working very diligently with all of our local schools. Right here in Cumberland County, Fayetteville State University, Methodist University, Fayetteville Technical Community College. We work hand in glove with those universities to help them grow their allied health professions. All of those programs produce outstanding nurses, and we're grateful for that. They also produce people like respiratory therapists, right? Nursing assistants, laboratory technicians, and we're working closely with them, and they're very responsive. We can't ask for more from our local universities than they're already doing. They're doing a wonderful job continuing to grow and expand the workforce. So those are real issues for us that we're working on, and the partnerships that we have in the region have been wonderful.
COVID.
Oh.
He said, It's still making the headlines, Mike, but it's not as intense as it was before. Now, as healthcare professionals, do you feel like the pandemic is over, or do you still have concerns that it could come back in the way it did during those difficult times?
Well, in life, we mark time by events, right? And I find myself often saying things like, oh, that was before the pandemic. That was after the pandemic. You know how you do that with weddings and your child's birth? We now do that with the pandemic. And, I think the issues we faced, especially in the early stages of the pandemic, was we didn't know. We didn't know what was going on. We really had very little information, and we didn't have tools. Right? I remember being here at WIDU with you.
That's right.
And people like Dr. Zappa and Dr. Jennifer Green from the health department.
We had roundtable discussions.
Right? Talking about that, because it was the only way to get education out to the public. And all we had back then were masks.
Yeah.
That's what we had. Right? Well, now we're in a different place. We understand what's going on. Right? And we have tools, namely vaccines. And Cape Fear Valley in North Carolina was a leader. We were one of the first health systems to have the vaccine available and being distributed. A moment of great pride for us. And I'll never forget those vaccination clinics.
Yes.
Right? Remember in the rehab auditorium?
Yes.
We had people lined up actually outside.
Yeah.
And they were so grateful to get the vaccination. And now we have boosters, right? So I don't see the pandemic coming back the way it did, right? But make no bones about it, and the doctor who's going to be on after me is going to tell you, COVID's here to stay, right? So you've not gotten your vaccination yet, please. That's the primary tool against this issue. So we're going to live with it. We still have members. I had a member of my family 3 weeks ago turn up COVID positive, right? The good news is now we know how to deal with it, and it's not as frightening as it was before. As a society, we're comfortable with vaccinations. We get our kids vaccinated when they're born, measles, mumps, rubella, all of that. We routinely get our flu shots. Now we will routinely get our COVID shots. So we're grateful that the pandemic is in our rearview mirror, but make no bones about it, COVID's here to stay.
Are there things that the health system, Mike, that the pandemic has changed forever?
There's no doubt about it. One of the things that we talk a lot about is the impact it had on children. We used to, every single day, have patients in our pediatric ED who had behavioral health issues, right? That's not new to us. And we have a wonderful child psychiatry program, and we're very proud of the work that they do. But something changed during the pandemic. I think the isolation, the removal from the classroom, all of that has fundamentally impacted that generation of children. So much so that every single day, Omega, we have more than a dozen children in a zone called the Purple Zone, which is specifically built as part of our pediatric emergency department to take care of children who are having behavioral health issues. As I said before, pre-pandemic, we always had that, but never at the volume that we have today. And then earlier during the broadcast, I talked about our adolescent unit.
Yeah.
Well, Omega, it's full.
Already?
It's full. Our adolescent, the day school opened, it filled. So just do some math. Right now, we have 16 adolescents. An adolescent is a 13-year-old up to an 18-year-old who are receiving inpatient care for behavioral health situation. In addition to that, I have another zone that's part of the pediatric emergency department where every day I'm housing 10 to 12 children, not just adolescents, but people younger than the age of 13 who are in need of some behavioral health counseling, service, and then we have the regular pediatric ED. So that is a very tangible, I think, long-lasting impact that the pandemic has laid at our feet. The other thing that I think we're seeing, and I view this as a positive, is remote healthcare.
Yes.
Right? Before the pandemic, it was rare. It was rare that you would do this with a physician.
Yeah.
Right? You made an appointment. You got a referral. You went to the doctor's office and you saw the physician. You might see one of their associates, but that was what we did. Well, I'll give you an example. My mother-in-law is 78 years old, right? And because of remote healthcare now, when she wants to talk to her physician, they often, not all the time, they often will make accommodations so she can visit with her physician just the same way you and I are reaching this radio audience today, via remote. Technology. And so I'm grateful that that is here to stay, because that's a game changer, right? Some people don't travel well, not just because they don't like to travel, because they have a health situation that makes it difficult, not just on them, but on their family, right? When you have a loved one who's confined to a wheelchair or to a bed, transport is a real issue. So I think remote medicine, telemedicine, is here to stay, and I think that's a good thing. So I think the pandemic brought some things that I wish we could do better with.
Yeah.
But it also brought some things like remote work and telemedicine that are here to stay, and I'm grateful for that.
Mr. Mike Nagowski, CEO of Cape Fear Valley Health, in studio guest on Making Rounds Live. Mike, I've read some news about the new planned homeless shelter that the city is working on, and I understand that Cape Fear Valley has been mentioned several times as a partner for that. Is still in the planning stages, I know, but is there anything that you can tell us about that?
Well, you know, you don't have to travel very far in any city or any community and look for homeless, right? Because it's everywhere. It's an epidemic, in my opinion. And I'm grateful that our elected officials at the city level and at the county level are being proactive about it. You know, just this weekend, I had a chance to tour True Vine Ministries. And, you know, they, on White Flag Days, is when the temperature goes below 32 degrees. They bring the homeless. They go out to get them. They bring them to their ministry, and they just do a wonderful job. I had a chance on Friday to tour the day center downtown, and wonderful facility, and it was packed, Omega. It just was packed. But even with those facilities, even with that, the need far outstrips the capacity of those facilities. So I'm grateful, especially on the commissioner side, that they're going to be proactive and create a new homeless shelter for our region. And solving the homeless situation or making an impact on it isn't going to be done by one entity on its own. It takes a community. And one of our biggest concerns about the homeless is they get sick just like all of us, right? They're human, right? And they have needs, and they have healthcare needs. So when they come to us, so I'll give you an example. If you have a homeless person who has an emergency and our doctors have to take care of them and they come to us, well, once their immediate medical needs are met, what do we do with them? You know, discharging them to under the bridge is not a satisfactory situation. Most people, when they're discharged from the hospital, are discharged with instructions and medications. And the homeless especially have difficulty receiving their medications and continuing on with their medications. One of the ways we help with that is everybody who's discharged from Cape Fear Valley, if they're discharged with medications, you know, a prescription for medication, we give it to them, right? Whether they can pay or not, right? Because we want them to get better. And for the homeless, those challenges are much different than for those of us who every night have a bed and a roof over us. So we are going to play a role in helping the homeless shelter come to fruition. We're still working hand in glove with the commissioners and with the city to make that happen. We're glad to be a part of that effort.
Lastly, Mike, is there anything that we haven't talked about that you would like for our listeners and our viewers to know?
Yeah. Well, one, again, thank you to WIDU and to you, Omega, for being with us and providing all this support. You guys are fabulous partners and a great community asset. The other thing I'd like to leave is for those people who are considering going into healthcare as a profession. In my opinion, it's one of the most noblest professions there is, because at the end of the day, you're saying, I'm there to take care of people in their most urgent times of need. Nobody wakes up in the morning and says, yeehaw, I gotta go to the hospital, right? Even if you have to deliver a baby or get a new knee, you just don't.
Yeah.
You're apprehensive. You're in your greatest time of need. So if you are interested in entering the workforce to take care of other people, please reach out to Cape Fear Valley. We have all sorts of programs in partnership with the local universities, and even universities like in Bladen County or up in Sanford, where we provide incredible financial assistance. Like, for example, if you want to become a nurse, we will pay for your education. Yeah. You too, Omega, can make that happen.
Wow.
Yeah, so if you want to become a nurse, we will pay for your education. All we ask in return is that you come to work for us for a few years, right? If you want to become a respiratory therapist, same thing. So that is what we're trying to do. We want to continue to grow the health outcomes in our regions and the economic vitality. Omega, thank you for giving me this time today.
Oh, no, thank you for taking time out of your busy schedule to be with us today, Mike. Ladies and gentlemen, Mr. Mike Nagowski, CEO of Cape Fear Valley Health. Now that we've touched on COVID a little, but what we're going to do is we're going to bring in our internal medicine doctor in just a bit to talk to us about these respiratory illnesses going on around the community. Cape Fear Valley is making rounds live. Make sure you stay close.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM, 1600 AM.
The We Do Radio Network.
This is Pastor Roy and co-pastor Madeline Rogers of Divine Refuge Ministries. And you're listening to Wake Up.
Get up from there.
North Carolina voters go to the polls on March 5th to decide nominees for races including president, governor, and other statewide and regional races. State Elections Director Karen Brinson-Bell says the last presidential election saw a strong turnout. Voters in New Hampshire are voting in the nation's first primary of the 2024 election. It's down to former President Donald Trump and former UN Ambassador Nikki Haley. The North Carolina Wildlife Resources Commission is proposing changes to deer and bear hunting season. U.S. officials say that the latest attacks on the Houthi rebels in Yemen have degraded their ability to attack merchant ships in the Red Sea. Oscar-nominated Canadian filmmaker Norman Jewison, who directed In the Heat of the Night and Moonstruck, among others, died peacefully over the weekend at his home. He was 97 years old. Mike Traley, NCN News.
I'm Jamie Monticelli, WIDU Radio News. Since the state expanded who is eligible for Medicaid on December 1st of last year, 314,101 Carolinians have enrolled in the program and now have access to comprehensive health care. That's according to the State Department of Health and Human Services Medicaid Expansion Enrollment Dashboard. The dashboard was updated yesterday and includes the number of people who have enrolled as of January 12th. Large numbers of those enrolling through Medicaid Expansion are young adults and or live in rural areas. Nearly 1 in 3 are between the ages of 19 and 29. Poor air quality in the Fayetteville area yesterday. The North Carolina Air Quality Forecast Center reported they were seeing fine particulate AQI values, especially near Fayetteville, due to strong high pressure and cold temperatures. That was expected to improve as the day went on yesterday. From WIDU Radio, I'm Jamie Monticelli.
I'm tracking some big changes to move in for this week. We are going to see the Arctic air move out and warmer temperatures will be moving in. In addition to the warmth, we're tracking rain chances to go up as well. High temperatures will be in the upper 50s and lower 60s for today with those early showers around. We will be dry by this evening and tonight. Temperatures down into the mid to upper 40s. Highs will reach the upper 60s and lower 70s tomorrow. I'm meteorologist Peter Sherwood in the Weather Center.
Are you looking to go solar but may not have an ideal roof or the ability to invest in a rooftop system? PwC offers the Community Solar Program for customers to subscribe to. Customers can enroll in the program, pay a monthly subscription fee, and in exchange, receive a bill credit for the value of the solar less the cost to operate. Learn more at faypwc.com.
When it comes to your heating and air conditioning needs, you need a company you can trust.
Langdon Heating and Air has a 5-star Google rating, so you know you're getting the best in the business. Find Langdon Heating and Air online at langdonair.com for all your heating and air conditioning needs.
Getting older and wiser is a part of life. But like all things, aging has its challenges, and it's often hard to know where to turn for answers. Listen to the AARP Without Limits podcast to get the best information to navigate the challenges of aging in North Carolina. Learn how to live your best life after 50. You can find the latest episodes of AARP Without Limits wherever you listen to your podcasts.
Hello, my name is Pastor George Coney Jr., the pastor of House of Prayer, Church of God in Christ. I want to say to you that's listening right now, from the sound of my voice, catch the vision, join the team, wake up. Pastors Coalition. We're better together. The Bible says, behold, how good and how pleasant it is for brethren to dwell together in unity. Come together, let's worship and praise God. In Jesus' name, amen. Catch the vision and join the team.
Hi, this is Lavette Jones, State Farm agent, providing insurance and financial services. You're listening to Wake Up.
Your local news brought to you by Fayetteville PWC. If you're using a heat pump to heat your home, here are some tips to help you save money. Set the thermostat to 68 degrees when you are not home. And when you adjust the thermostat, only adjust it at a degree or two at a time to avoid using the auxiliary heating strips, which can use up a lot of energy. Visit faypwc.com for more saving tips.
Regular seasonal maintenance on your heating and air conditioning unit can lower your energy bills and extend the life of your equipment. Call Langdon Heating and Air Conditioning today for your spring-summer checkup. Langdon Heating and Air, online at langdonair.com.
Getting older and wiser is a part of life. But like all things, aging has its challenges, and it's often hard to know where to turn for answers. Listen to the AARP Without Limits podcast to get the best information to navigate the challenges of aging in North Carolina. Learn how to live your best life after 50. You can find the latest episodes of AARP Without Limits wherever you listen to your podcasts.
Catch the vision, join the team. My name is Pastor George Coney Jr. I'm a proud member of the Wake Up Committee, and I want to encourage you to join the team, catch the vision, because whatever you have that's good for the church is good for the team that we have here at WIDU. Catch the vision, join the team.
Hi, this is Lavette Jones, State Farm agent, providing insurance and financial services. You're listening to Wake Up.
Hi, I'm Dr. Teresa McAllister, the founder of Rafa Ministries Family Center, and I'm proud to be a part of Wake Up.
We now return to Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live on the WIDU network, 99.7 FM, 1600 AM. Here's Omega Jones.
Thank you so much, Ray. Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live. Want to thank Mike Nagowski again, CEO of Cape Fear Valley Health, for taking time out of his busy schedule to be with us today because he's already out on another meeting. But I do need to let everyone know before we bring our next guest in that Cape Fear Valley Health's Blood Donor Center is in critical need of blood. They are below, I'm just going off my cuff here, but they are below their recommendations or the recommended amount. They need donors. They've only got a 2-day supply. They need donors urgently, and especially African American donors. So what I want you to do is make sure you drop by Cape Fear Valley's Blood Donor Center, which is right across the street from the emergency department, or you can go to savingliveslocally.org. That's savingliveslocally.org, and you'll be able to get that where they're having their mobile blood donations going on. But anyway, I just wanted to let you know to make sure you help Cape Fear Valley's Blood Donor Center because they're in dire need of blood right now. 2-day supply. If a major accident were to happen this afternoon or this evening, they could go through that 2-day of supply today. So that's the reason why They really need those donors. So make sure you do that. So, ladies and gentlemen, if you're like me, you've already learned firsthand that we're in the middle of respiratory virus season. And here to talk to us about this, Dr. Humza Rana. He is from Cape Fear Valley Health's internal medicine residency program, and understand that he's here from Florida. I would tell you all about the man, but I'll let him do that himself. Welcome to Making Rounds Live, Dr. Rana. How are you today?
I'm good. How are you doing? Thank you so much for having me.
You are so welcome. Dr. Rana, well, first of all, before I ask you about these respiratory things, tell us a little bit about yourself.
All right, so my name is Humza. I'm born and raised in Buffalo, New York, actually, up north, so kind of used to this cold front we got going on here. But yeah, so big Buffalo Bills fan, bad loss a couple days ago, but you know what? There's always next year, right?
It's always next year. Or at least that's what I say, and I'm a Carolina Panthers fan, so you already know. So, Dr. Rana, what are some of the main respiratory viruses that you're seeing right now in our area?
Yeah, so, in general, just all the viruses we've been seeing in the hospital, especially last few weeks and months or so, has been, the common flu that we see every year come around, COVID, like we talked about earlier, and then also RSV, respiratory syncytial virus. So these are things that we've been seeing in kind of all populations of people, kids to, older adults, and just, middle-aged individuals. It's been kind of, everyone's kind of been infected with that recently.
Now, are these the viruses that you talked about, is it the same for adults and for children?
Yeah, exactly. Technically, you can get infected even if you're an adult or a kid, but obviously at the ends of the spectrum, you're more at risk for more complications. So, greater than 65 and less than 5, where when you're older, your immune system, you might have some other medical conditions, making it harder to kind of fight off some of these infections. When you're a little bit younger, your immune system hasn't fully developed yet either. So, but everyone kind of can get the same, the viral infections we've been talking about.
Now, what are some of the symptoms of these viruses? What are some of the symptoms these viruses bring, and how would we know to tell them apart?
So it's tough, right? Because a lot of the viral infections that we see and we've grown up with over the years, there's a lot of overlap between the symptoms. You got the scratchy throat, you'll have some nasal congestion, sometimes as severe as, shortness of breath and, trouble, just when you walk a few steps, some exertional, fatigue and things like that. So again, it's tough to say that based on just the symptoms alone, you'll be able to tell what the virus is. But at the same time, what time of the year it is. It's flu season. COVID is kind of picking back up. So you have an idea of kind of what you're dealing with. But exact specifics is sometimes tough to discern initially.
Dr. Humza Rana from Cape Fear Valley Health's internal medicine residency on Making Rounds Live today. Dr. Rana, well, I need to ask this question because this one just popped in my head. Is it too late for people to get flu shots around here?
It is not. It is not. The flu season, I know we think of it as a winter time of the year, but it goes, as from October all the way as late as to May. So at any point, throughout that time period, getting that vaccine does help kind of maybe mitigate the effects of the infection, reduce hospitalizations, and overall just it's a good thing to do if you're able to go ahead and get that still.
What advice do you have for our listeners who they really don't want any of this? They don't want the flu. They don't want the COVID. They don't even want the sniffles. What advice do you have for listeners about this?
And I know no one obviously, wants to get sick, and it is, everyone's getting sick around now. So there's some basic things you can do to kind of help reduce the risk. It's not going to go to 0%, but obviously it will reduce your chances. So I know the basic things we learned when we were kids in school is, wash your hands. I know it's something so cliche and we forget about it sometimes, but it is sometimes just that simple. Just making sure you wash your hands, Another thing is, when I was a kid, we were kind of making that shift from, sneezing, when you sneeze or cough into your hands, going into your elbow, right? And so that's another thing, because when you cough or sneeze, that infection's on your hands, you're touching things and maybe touching your eyes and face, and it spreads a lot faster that way. Whereas if you go into your arm, it does reduce that. So those are some basic things. And then I'd say over the last few years, especially with the pandemic, we've learned that a lot of talk about masks. And so the good thing about masks, it kind of not only mitigates your own risk, but also stops you from maybe infecting someone else. Just the nature of a mask, right? It's a barrier, right? So if there's infection in the air, there's particulates in the air, that if you breathe it in, obviously naturally you're more at risk of catching that infection. Whereas with a mask, it kind of helps filter that out and it stops you from getting it. And vice versa. If you're the one who's sick and you're coughing and sneezing, a lot of times you don't realize when you talk, when you're talking and you're speaking, coughing, the particulates are in the air for some time. But whereas if you wear that mask, it kind of does stop that from spreading into the air. So it does help the people around you and also yourself.
Dr. Rana from Cape Fear Valley's internal medicine residency on Cape Fear Valley is making rounds live. Dr. Rana, what about if it's too late, you've already started feeling sick? What would be your advice for the folks or the folks' children that have already started showing symptoms?
So I'll start by, saying that most of the times, if it's a viral infection, it is kind of, your body has that immune response to kind of handle it, and that's most infections, right? So most viral infections. So that's, I'd say I'll start with some of the good news, right? So, and then also taking a look at what are the symptoms you're experiencing. Now, are you having some shortness of breath? Are you having some wheezing? If you already have oxygen that you're on at home, are you requiring more oxygen? Are you, if a family member is a little bit older, getting a little confused? If they're a little bit younger, are you hearing the wheezing like we were talking about shortness of breath? Now, these are times where now you need to maybe take action towards getting some further medical help. But for the most part, you're going to see this resolve on your own.
What is Cape Fear Valley doing to help stop the spread of respiratory viruses?
So it looks like, especially because of the season we're in right now and the uptick in, all these viral infections we're seeing, there's a policy for masks if you're having these symptoms, visitation for someone who's been infected with that pneumonia, like a COVID pneumonia, influenza, they're required to wear a mask. Visitation policy for them is also very specific. Same with, requiring masks in the ED waiting room. So there is some, different precautions that are being taken, kind of adjusting to what we're seeing right now in the hospital, but also what we see in the hospital is based on what we're seeing in the community. So we're kind of adjusting based on what's going on currently at the ground level.
Dr. Rana, the pandemic made a lot of people hear a lot of different opinions about wearing masks. I know you've already talked about that, but I want to make sure people hear this and get this. What is it, or why is it so important for folks to choose to wear a mask if they are worried about getting sick or if they don't want to become sick?
Yeah, no, exactly like we talked about a little bit earlier. But again, if you just take a look at kind of how do you catch these infections in the first place, right? If there's particulates in the air, someone just recently was sick and they're coughing, it's in the air, it's you can't see it, it's there. But when you have a mask on, it does help maybe filter some of those particulates out. Like I said, it's not 100%, everything's not 100% foolproof, but our whole goal is to kind of reduce that risk and that chance, right? And that's what we're talking about here today. So that's one aspect of it for kind of protecting against it. And then also if you yourself are not feeling the best, you're having a cough, you're feeling under the weather, wearing the mask also reduces those particulates being in the air to kind of stop from anybody else getting infected as well. So it's a dual function, but again, it's a barrier that kind of helps with that process, So I guess it just helps kind of reiterating that, talking about how do you catch it in the first place? Does it reduce the risk or not? And that's what our goal is right now. Can we do a lot of things to add up to bring the risk down?
Let's talk about viral pneumonia. Is that something you can catch, or is this something that you risk when you catch something else?
So, most of the time, a lot of the viral pathogens that we have that cause these infections can lead to pneumonia, essentially just going into your lungs and causing that infection. So technically, you can get infected with the virus that caused that pneumonia. So that is something that you can't get infected with. And you have to be obviously careful if you have a family member who's, in fact, has that condition and is struggling with that, wearing a mask around them and kind of making sure that, you're taking the right precautions when you're around that. And usually, a lot of times what you see is kind of the other way around with viral to bacterial. So when you do catch these viral infections, your naturally, your body's, fighting it off, it weakens a little bit, and you do sometimes get a bacterial infection soon after. And kind of being able to tell that is, if you feel like you got sick and you started feeling a little bit better, and then all of a sudden you got sick again,
that creaky feeling again.
That's probably a sign that you kind of going through that cycle where you got some viral kind of infection, and now you have a bacterial infection.
Dr. Rana on Making Rounds Live. Dr. Rana, how do you know when your respiratory illness is more than a cold? And when is the best time for you to go see a primary care doctor or go to the express care?
And I think that's a good question. Because at the end of the day, we got to figure out, okay, now there's only so much we talked about kind of mitigating the risk. Now, if it happens, what do we do? And then if it happens, how do we know? Is this something that, do I just take care of myself? Do I just, hydrate, get some rest, or do I need some attention? Do I need some medical attention? So I'll start with some of the alarm symptoms that you should be concerned for, and you'd want to seek out some, some attention, medical attention. Now, like we talked about earlier in the show, that if you have some shortness of breath, you can't catch your breath. If you have a family member who's getting confused, they're having some altered mental status. If you're having this new onset wheezing, maybe you have a history of COPD or asthma, and the inhalers aren't helping. In those situations, you don't hesitate. You need to most likely get to the ED. But a lot of times, you're in that limbo, in that middle period where you're not feeling the best, but you don't know what to do. And so, like you mentioned in the beginning of your question was, when do I go to my primary doctor? And I think that's a resource that I just want to kind of reiterate is very important. Primary care doctors aren't just for, your yearly visit, for the refills. It's also for these moments where you're not feeling well. You don't have to be your own medical professional. Reaching out to their office and kind of talking to them, hey, this is what I'm going through, this is what I'm feeling. They're aware of your conditions, the medications you take. They can kind of tell based on, overall your medical profile and where they recommend you going right now. And most offices, even if your doctor is out after hours or the weekend, most offices have an on-call doctor who will be able to take that call and have that conversation with you. You know what, this doesn't feel too bad. Maybe you should just wait till Monday, make an appointment. Okay, maybe you should go to the ED, and they can kind of help triage and help you kind of manage what to do. So that's something that I think is very important. Now, if you don't have a primary care doctor, that's okay. Urgent cares also have physicians there where they can kind of go through that same process with you. But again, I'd recommend everybody, if you don't have a primary care physician,
Get one.
Definitely get one.
Definitely get one. Especially like you had just said, my physician, Dr. Johnny Moultrie. If I don't show up to him when I'm sick and he runs tests, for however reason, he can tell that I've been sick. And then he's like, well, why didn't you contact me? And I was like, I don't know. And so, but he can usually tell. So like Dr. Rana said, get yourself a personal physician. That way your physician knows you. Top, back, up, down, the physician knows you. Now, Dr. Rana, what about the emergency department? When is it time to just totally skip the express care and go straight to the ED?
And, that's where if you having trouble breathing, obviously if you can't catch your breath, like we talked about, patients who have this history of any kind of pulmonary conditions are at more risk for kind of disease progression. So if you have shortness of breath and you can't catch your breath, if you see a family member who's struggling, a lot of times you yourself don't notice that you're struggling. You kind of get used to it. You're not noticing. If you have a family member you're seeing is struggling to catch their breath, having a cough that they can't clear out their phlegm, they're maybe getting altered. You see them blue. These are all alarm signs to kind of, not take that slower process of calling your doctor, going to express, kind of getting to the ED. And, at the end of the day, if you still didn't need it, at least they can do the proper workup, let you know what you need to do next. And go from there. But I think these are some of the signs and symptoms that you're looking for. If you start experiencing or you're seeing someone in your family experience, to kind of get over to the ED.
Before I forget, we were talking about telemedicine last hour, or not last hour, last segment with Mike Nagowski. Can a first-time visit or a new patient visit, can that be done through a telehealth appointment?
Yeah, so I know we were talking about how with telemedicine, it's made it a lot easier to kind of have better patient follow-up and make it easier for patients. It's hard to kind of, get out of the house because of some conditions that they have. But for a first-time visit, I would recommend, doing that in person.
In person?
Because I would say that a lot of patient care is a relationship between the doctor and the physician. And I think that's one thing we did learn. I know a lot of the benefits that we saw from all the technological advancements we have, but we did notice that nothing makes up for that in-person conversation and relationship you build through that. So I think that building that relationship, that trust, is obviously going to be easier to do in that inpatient, in that in-person setting.
Yeah.
And also a big aspect of medicine, especially if it's the first time, a physician is seeing you or you're seeing a physician, is the physical examination, examining you overall and getting a full top to bottom understanding of what your conditions are, what some of your signs and symptoms might be. And so I'd say for the first time, for the reason we just outlined earlier, I think it'd be best to go in person as opposed to being telemedicine. But in the future, if you've established that relationship, you have that trust, that understanding with each other, obviously it's an amazing resource there, and it makes it way easier for the patient overall to continue to follow up with their providers.
All right. Lastly, Dr. Rana, is there anything else about respiratory viruses, bacterial infections, viral infections, anything that we haven't talked about that you want, or anything that you want to stress to our listener before we close out this particular segment?
I'd say just two things kind of touching back on. One thing would be that a lot of the viral infections that we have are, self-resolving. And so we want to do supportive measures. And we're supporting our immune system. And like we talked about, doing that with, good rest, hydration, good diet. These are simple things you can do. But again, like I said, we forget that. We're not feeling the best, and we have to keep pushing along. If you can find a way to kind of, optimize those things, hopefully you'll have a quicker recovery. And then just touching one more time on the topic of, establishing that care with that primary doctor.
Yes.
I think that's something that goes without saying how important that is, but especially in this season and with these types of infections and conditions, it's very helpful. It's a great resource to have at your disposal. So just want to touch on that one more time.
Well, any advice that you have for someone, because I know in this community, a lot of people don't have personal physicians because of a lack of trust. So what do you tell them? What advice do you have for them?
I would say that the trust, every provider is different, to hopefully, just like how providers, they're going to try their best to understand you. Hopefully go in with an open mind and talk to them, be honest with them. And like I said, it is your choice. If you don't feel like this is a person that you feel like is going to take care of you the way maybe you want, and for whatever reason it might be, it's your choice, but exploring that and seeing that until you find someone that you do trust, that you can build a relationship with, and hopefully they can be someone that, continues to manage your care in the long term.
Awesome. Ladies and gentlemen, Dr. Humza Rana. He is with Cape Fear Valley's internal medicine residency program. And Dr. Rana, you're a resident, so this is a final question that's not on the list. Have you bought you a house yet?
I have not.
Okay, ladies and gentlemen, please join me in thanking Dr. Rana for being with us today. And during the first segment of the broadcast, Mr. Mike Nagowski. Well, this wraps up another episode, ladies and gentlemen. Our next broadcast will be Tuesday, February 13th. And that's the day before Valentine's Day. So you already know we're going to talk about heart health, and Ms. Shonda Ray is going to be with us that day, and we have a doctor from Cape Fear Cardiology Associates that are going to be with us that day as well. So for our producers, Shaka Jordan, Lindsey Graham, and Ray Thomas, the team behind the scenes, I'm Omega Jones, continuing the legacy of Darvin Jones. Thanks for listening to Cape Fear Valley Health's Making Rounds Live.
Your station for inspiration and information.